At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to this very special episode of the Global Liver Institute's GLI Live. We are going to be talking today with one of our partners from Africa, talking about building liver health resilience in Cameroon. As some of you know, one of the things that puts the G in GLI is our global outreach partnership support for community organizations, including town hall meetings that we had throughout October as part of October is for Livers Month. And so I have with me today Dr. Livancliff, who is a non-communicable disease researcher, a Bosch alumni fellow, which is a very prestigious fellowship. He also, in addition to his work with Value Health Africa, has partnered with Empower Women Foundation. We know that that's so important to health for our communities in African countries and around the world. And so, Dr. Livancliff, welcome. Thank you.
Thank you so much. Thank you so much, Donna. It's a pleasure to be here. I'm really excited. Thank you so much for having me.
Absolutely. Tell people about Value Health Africa.
Okay, so a little about me. I'm a medical practitioner as well as a public health specialist, but with more direction towards non-communicable diseases. So with Value Health Africa, I'm the NCD focal point, where my work revolves about research on non-communicable diseases, specifically liver disease, cancer of the cervix, cancer of the liver, cancer of the breast, as well as a tool designer where I design community strategies to improve access to diagnosis and management. So basically, that is what I do with Value Health Africa.
That's fantastic. And so how did you become connected to GLI? I want everybody to sort of hear the story. I know there's so many ways and paths. Sometimes I wake up in the morning and answer an email from Malaysia. Sometimes, you know, our European director, Giacomo Donini, has reached out to people. How did you hear about us?
Okay, I think I first got about GLI was from a recommendation from a friend who heard about it on online from Facebook and sent me the link. I think it was like, hey guy, I know you have been working on this stuff. Can you check this out? These guys are great. So that is how I think that was doing when they were having the NASH. The NASH campaign. So that is how I looked at it and applied for the NASH grant. And luckily we got it. We partnered with GLI for the NASH. And that is how our partnership started with GLI. And it has been amazing. It has really been amazing. I keep telling my friend, I said, hey guy, thank you so much for that link that you sent.
I so appreciate that. And that's why, you know, we try to be on every platform, because we know that there are people who are doing wonderful work all around the world that need and deserve support and spotlight. And we're so excited that that link was passed to you so that we could support your work. And you have many partnerships, and the Empower Women Foundation is one of them. Tell me, you know, how you connect and work together and add value.
Yeah, I think what really made me to partner with Empower Women, it's their more focus on liver, and especially liver disease in women. and they are doing a lot of research in hepatitis in pregnant women, hepatitis about sexual specificities with gay men, lesbian women. So I think that the specificity of your group caught my attention because they had a unique group that they target, and that is why I feel like it was an area that it's less been spoken of and less research is being done on it. And as a researcher, that caught my interest because we really want to it's a target group to me that has a lot of issues. You know, being sexually active and being prone with hepatitis, and also being very agile. Women are the most caregivers and are prone of getting infections from the hospital. So they are more blood patient carers, and so they feel the burden and the weight for liver disease. So I felt like that group gave me a uniqueness so that I can go in there, do research on a particular group and find out what is happening within them. So that is what really caught my attention with Empower Women Foundation.
I think that's fantastic, and it really is a model for what we hope more of our partners will do to reach out to organizations, even if they don't have liver in the name. They still have people, and people have livers, and people are dealing with these issues, and we need to bring them in and hold them close and do this work together. So we've been so excited to see how you approach that project, and you know, we'll include some of the pictures that we saw. They made my day. They opened my heart. But you had really great attendance at the event in October. You know, tell us about some of the things that went on and the aha moments. You know, that really created such a great energy there.
Yeah, October for livers. I think the impact of that event is still being felt now. I can't remember. I was in the hospital last week, and everybody like, the pink campaign. So they keep remembering what was being done. And the aha moment for me was, first, this is something that has never happened, and patients have never been brought to a platform to discuss their challenges. And this was what marveled them. They have challenges that they feel like their voices need to be heard, but they have never had the opportunity, the platform to speak out, to discuss what worries them, what bothers them, and to co-create strategies together to see how we can ameliorate the conditions that they find themselves in. So that was the first aha moment. And the second aha moment was the engagement from the participants. It was marvelous. Everybody felt concerned because we used a novel approach that we call the human-centered design approach, where we bring out different stakeholders. We brought in one room public health specialists, liver disease specialists. We brought GPs together, caregivers and patients in one platform to discuss. And we had different segments where caregivers discuss specifically the challenge they face in taking care of patients who suffer from liver disease. Patients themselves discuss their challenges. Doctors themselves discuss the challenges. Public health experts discuss why this is not getting traction. Why are we having challenges in getting traction for liver disease, though we have a very high prevalence of hepatitis? So it was a marvelous thing for me. And after the event, everybody was like, this is something we need to push forward. We need to get advocacy greater. We need to make our voice heard. Then lastly, the aha moment was, we got good news at the end. We got good news from the government, and we were like, yeah, we did it. This is awesome. Our little voice made a difference. And to us, that was really wonderful to see.
And tell people more about that result, that achievement that your United Voices was able to do to increase access to hepatitis B medications in your community.
Yeah, access to medications have been a very big deal for patients, and most of the times the patients don't take their medication because they don't have the means. In my community, I come from a community where, due to the crisis, it's an IDP, it's a war settlement, and many people are very vulnerable. They don't have what to eat, so the patients are really going through a lot. So after that event, we had to write a joint statement that was signed by all of us. and we sent it to the central level, to Yaoundé, to the Ministry of Health, and we say, this is what patients are facing. They are unable to access drugs because it is too expensive, and we are having high mortality rate, and something needs to be done. I remember I received a reply. I'm like, hey, Dr. Cliff, your mail has been received, and we are going to forward it to the minister for a strategic meeting. And after the result, and we had a communique from the MOH that the price of pegylated interferon has been reduced, and also the price for Bactrit and Viriat has been reduced from 25,000 francs for pegylated interferon to 10,000 francs. Imagine the difference. That is more than half reduction of the prices. So it was a very big victory for us. I remember some of the patients, after getting the news, called us and were like, yay, thank you guys so much for this. So it was a wonderful moment for us.
That is fantastic. You know, we hear more and more about how hepatitis B can convert to hepatitis delta and drive liver cancers. And so, you know, by getting more people who can access more than, I mean, if the price is half, they can get twice as many people who can access the medication, ideally, then that many more people can avoid liver cancer and just the disease and you know, disability from hepatitis B and D itself. And so, you know, this one day, this one energy, as you're right, I still feel the ripple effects. It's saving so many lives and serving as a model for others. You know, what do you want to do next now that you have this, you know, success under your belt with this group? Now that you know what you can do with the power of patients and physicians and everybody all together, what do you want to do next?
Yeah, this is very important, because this is what we have been reflecting over the past weeks and months. And I think, firstly, what really limited advocacy is availability of data. There is not enough data to drive advocacy actions. And I think this is what we really need to do. So the first thing we're thinking on, how do we get enough evidence? If you go to the Cameroon website, you will see very limited data on hepatitis B, hepatitis C. Very limited research, and very I remember the first time I went to the ministry when we did NASH, and I went to the ministry to like, hey, we need to start thinking about this. And the Secretary General asked me, I have not heard about NASH, I've not seen anything, it's not a burden, it's not a problem for Cameroon. I'm like, hey, I had to go and review a small research that was done in a hospital using a smaller cohort of participants, and showed him the problem. And I was like, hey, if you see the within this smaller population, then if we extrapolate, and this is due to limited in diagnostic ability, just imagine a number of cases that are out there undiagnosed. So, and that really slowed down the way the government will act, because we don't have enough data to back our action. So the first thing is, how do we create this data? How do we pile up data that can sustain and that can strengthen our advocacy actions? And the second thing is, which is from our HCD approach, how do patients access diagnosis? I think this is linked with the data, because access of diagnostic equipment will give us the data that we need. RODTs are very expensive. They are not free. They are very expensive. Most patients cannot afford liver biopsy. It's way expensive. Ultrasound, it's out of reach. So patients cannot access diagnostic equipment, and as such, we cannot generate this data. So we were thinking about, how do we partner with a diagnostic center for a number of years, so that we can refer patients to that center, that they can be tested for free to generate this data. Once we have this data, we will be able now to drive advocacy action, why we need to make free hepatitis testing, and why we have to drive, we need to talk about NASH, we need to talk about liver disease, because people can see now, yes, truly it is a problem. Yes, truly it is a Cameroon burden, and public health policy makers can include it in the public health action. So that is the next step for us. That is the next step we see very, very important. And I think GLI is very strategic in assisting us in this next step.
Yes, we are very excited. And you articulated so well the chain from being able to be effective advocates on a policy level to being able to get the data to make your case, and how connected they are, and why so often we go, way, I don't know, upstream or downstream, to talking about non-invasive diagnostics and getting beyond the biopsy, which are unaffordable and unsustainable and unscalable, to being able to then really understand how many people are truly affected by the different types of liver diseases. If we can't bring testing, whether blood or imaging or whatever, to people, communities, or help them get to the centers to be screened, we'll never be able to accurately, convey the urgency and the seriousness of the problems, of the challenges of our community. So we wholeheartedly agree with your approach, and it was a central conversation as we launched our GLI Center for Liver Health Equity, to make sure that there was the data to support the disparities that we were seeing in some liver diseases, because we have been so overlooked or ignored or kept out of systems. It seems as if we don't even get different types of liver disease, but we know that's not the case because we have them ourselves, and the few of us who have been able to be diagnosed. And so to be able to paint a more accurate picture and have the fullness of our advocacy, I think you're absolutely right. We need to go back and make sure that there's better screening, connection to care, so that we can have better data.
Yeah, absolutely.
Sounds like a fabulous project. Now, what would be the most helpful thing? I know that there are some attempts at mobile imaging. There are, maybe, transportation to more central facilities. What would work best for the, the people that you talk with?
Yeah, for the communities we are talking about, I think what will work best in our setting would be more like a mobile imaging facility, because when we talk about fixed, we talk about also distances in transportation, logistics will be more difficult. So a mobile imaging will be more better, because then you can work with different communities. You can plan rendezvous in different communities, and you can descend down in different communities, rather than transporting people to a particular imaging center, which will be more cost effective, more costly, and also many people, like for particular patients with liver disease that are in advanced stage, might not find the journey so comforting. So it will be a huge barrier. So a mobile imaging would be best, and also doing mobile campaigns, free campaigns for test strips, Hep B, Hep C test strips will be amazing. Because the thing is, many people want to be tested. They love to be tested, but they don't have the means to get tested.
Right.
I remember when after we did that open house, we as well launched a free campaign for hepatitis B and C, and we were amazed. The population that turned out were more than even the strips we had. So we were like, oh my God, and I had to apologize, like, we ran out of strips, and I'm sorry. So it was painful to have somebody walk back home without being tested, because the tools are not there. And
it's interesting because so often we make assumptions about what people are willing to do or what they want, and say that they don't care about their health, but they do. And that holds true from Cameroon to, San Diego. Our screening there, was filled up in one day. When it came from the community to the community, where there was trust and credibility, and people understood that we were trying to, do something to help each other, then I think you see an overwhelming response. And so we want to make sure that we can, meet that need better and not turn anyone away. Do you also see the opportunity to go from hepatitis B screening and education to NASH screening and education and liver cancer, and really have like a liver health hub or liver health sort of education center with these mobile opportunities?
Perfect. I think you just phrased it right. And I think this was one of my discussions with Giacomo. And I was telling him that among our challenges is also people are not well informed. Mm-hmm. I painted this quite right when we're doing a NASH, even among healthcare professionals in my mm-hmm. setting. Because I remember some of my friends who were GPs were hearing NASH for their very first time, mm-hmm. and they kept asking me, they kept asking for tools, and I think I've reached out to Giacomo for tools, and he has sent me some information, and we were trying to see how we can make them into short manuals, like contextualize them for mm-hmm. different personas, for GPs, for specialists, for caregivers, for patients themselves, for nurses. So these different personas have this information contextualized in their domain. I think it will be amazing. I think that's what we're looking for, but unfortunately, mm-hmm. we have not yet had the finance to do that. But that is our thing. I'm also looking at mm-hmm. translate it to our local language, especially mm-hmm. for patients and your caregivers. Mm-hmm. This information, because one thing the caregivers they cry is they don't know what support they can provide. In nutrition, right. They don't know what support they can provide. They mm-hmm. really want to support their patients, but at times they don't know what to do. And one carer really cried. Like there was time he went to the doctor like, please, can you give me more information? And the doctor is like, oh, I don't have time. And he felt frustrated because he was like, I need information. I want to help right. my patient. It was his mom, but I feel like I don't have enough information to help my mom. So I think this will really be, if we are able to mm-hmm. do this, it will be a game changer across the different personas, and people will have information to help a patient. Also, patient will have information to sustain themselves as well, to help engage in their health. Because I feel like when patients are informed, they can collaborate in their health. Because in my right. setting, health has not really been participatory. Health has been delivered from up to down. Right. And most right. patients are feeling frustrated because they need mm-hmm. more information. Most of them don't even know their condition. I remember I had to take time during our open house. That's when I had to take time to explain to the woman what she was suffering from, what was happening within her. The doctor did not tell her anything. So she did not even know what she was. Why is she taking these drugs for this number of times? Why does she have to make this life change adjustments? Nothing was communicated to her. So she just felt like a lot of laws were heaped onto her that she has to follow, but she doesn't know why. She's not participating in it, and she feels mm-hmm. frustrated. And that is that is what we want to change. That is what we want to change. So we want to take a different approach where the patients, they are informed and they collaborate in the management of their health.
I think that is fantastic. So I know that you probably had these conversations with some of the GLI staff, but I want to just reemphasize that we welcome your input and your community members into the types of questions that need to be asked and answered in our GLI materials. And tell us, what languages we need them in. I know they're in, French, and I believe they're all in Swahili. And so, tell us what's the next language or dialects that we need to have, our materials, printed in or translated audio versions of. We want people to have things in the languages that they're, comfortable and conversant in, so that it makes sense to them. So
Yeah, I think we are going to help in making those outputs, and I think key is to make manuals to specific personas. I don't know if that is what is available at GLI at the moment, but manuals for healthcare providers, general practitioners,
Mm-hmm.
manuals for internists,
Mm-hmm.
oncologists,
Mm-hmm.
manuals for nurses, manuals for patients, maybe for different liver disease, hepatitis,
Mm-hmm.
for liver cancer or not, and also manuals for caregivers, so
Right.
that when we have these manuals from these different personas, then we know that each persona have what is unique to them.
I think that's absolutely the goal. We've been trying really hard not to duplicate any efforts coming out of medical societies or what have you. But I think that um, there is a role for us in making them more sort of linguistically and culturally appropriate and simpler to use. They'll be updated. ASLD guidelines at the end of the month. EASL has new guidelines and things. Some work in curating and simplifying and then getting them out in the right languages to people are. It is really important. And I think we can absolutely do that. We've made little like index cards for things so it's easy to pass around or put into things. And so just thinking about those other different formats so that they really can get out to people is important. It's not just that like, oh, you can download them here. Even if I have to travel around, as I remember delivering some of our materials in Spanish to the Spanish advocacy organization in Barcelona, and they were like, "For us," and I was like, "Sí, por tú," and after that, they were downloading and accessing them. But I think they just really needed to know. I'm like, yes, we really created this for you. They're free. We wanted you, to have them, and it just meant so much, that connection, and that we had thought enough to create them just for them, to make it easier for them to do the work that they were doing in their community. And that's what we live for.
Absolutely, absolutely. And with such materials, making hubs will be very, very perfect. Having
Mm-hmm.
people come in, discussing the tools, and also maybe we can also look at developing an education for teachers, those who want to organize
Yes.
hubs, liver hubs. What is your manual that they can use to
Mm-hmm.
educate, to sensitize? It will be marvelous. I think this will really, in our setting,
Mm-hmm.
it will be awesome, because when we live in a setting where people don't have access to internet.
Right.
This is very true. Like when I
Right.
started sharing some of the things to download, they tell me I don't even have an Android phone. How am I going to download it? I don't even have an app that can even
Right.
open it.
Right.
So we need to be realistic in our context. What works for our context? So if it's an online site for them to download, trust me, nobody will access it. They will not have access to it. So
Right.
I think,
Right.
yeah. So context specificity, it's very important as well. So if we are able to do that, I think for Africa, no, I don't speak only for Cameroon, but
Mm-hmm. Right.
it's really going to be a big change in the African context.
I think that's so important to us. Both of my parents were school teachers, and so their legacy was their students and everyone that they taught, and every life that they improved. And so even though I'm technically not a school teacher, I still hope and aspire to moving their legacy forward, by helping others learn and understand how to take better care of themselves and lead healthier lives. So thank you for your partnership in that.
Thank you so much. Thank you.
I'm so excited. We have a lot of work to do together, but I'm excited to do it.
Yeah, myself, I'm really excited, and I think we are going to begin something that will be like a blueprint. It's going to
Yeah.
be Cameroon, because my dream is taking liver health in another level in Africa, not only in Cameroon.
Mm-hmm.
I think we need to push it forward there, and I said to myself, Cliff, this is what you live for. You have always wanted this. I
Mm-hmm.
think most of my family has been really, really, really done with non-communicable diseases. So to me,
Mm-hmm.
it's a pleasure to really push this forward, and And like I said, it's a silent killer. And unfortunately, we live in a setting where healthcare access is a problem, and people only think they have a problem if they started manifesting symptoms.
Right.
And that is why during our annual health meeting in our region, I really put it forward. We need to stop looking at treatment. We need to invest more in prevention, more in identification at an early stage. And you know, with most NCDs, early stage, early identification is key in management. So, and if we don't support our communities, if we don't support the population, and we allow them to themselves, they don't have the information first, and they don't have the means second to take care of their health. It's not that they don't want to. I give an example. For example, I'm a father. Unfortunately, I lost my daughter some months back. So I think if the health of my child is put in the balance, and I think if I don't see an inherent danger to my life, and my child has to eat and my child has to go to school, I will prioritize that. Because I don't feel there's an inherent danger to my life, but I will prioritize the education and feeding of my child. So this is a decision that most parents, most people in our community have to make. And most often they will make the second choice, prioritizing their families rather than their own health. So then it's not that they don't care, but it's just that hard choice that they need to make. And we need to support them in this. We need to support them in their health, empower them, provide them with access so that they can live better lives and they live healthy to be able to take care of your families.
I cannot think of a more perfect message, a more loving message, a message that I can't help all of us would support. So thank you, Dr. Livancliff.
Thank you so much, Donna. Thank you. I really appreciate the opportunity. Thank you so much.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.